Hi everyone, welcome to Camille's Holistic Health Show. I'm Dr. Camille or Dr. Cam, and today we are going to discuss insomnia, the causes, the effects during stress, and the things you can do in order to deal with it. Now, if this is a video that you're really interested in, then hit that subscribe button and hit that bell to get notified every time I have a new video coming out. So let's begin. So insomnia is a whole lot more than your body really telling you that you didn't have enough sleep. It actually is a lot more complicated. And actually, insomnia is your body's way of letting you know that something is wrong at a deeper level. And insomnia is different in each person. It ranges differently from person to person. Just someone can't fall asleep. Others wake up in the middle of the night. They are unable to fall back to sleep and wake up too much or too early. Um, so it might also be related to drinking too much caffeine, anxiety, depression, some mood problems, conflicts with inner struggle that's going on in your life, and pain, either arthritis, digestive problems, migraines. And so it also might be related to your hormones, and we're going to go into that a little later. So most adults require about 7 to 8 hours, we know, to sleep each night, but that can actually vary depending on person to person. And usually a person knows if they haven't gotten enough sleep. You actually wake up not feeling refreshed the next day, and you may feel tired, a lack of energy. Odds are that you're just not having that proper sleep that you need. And like I had mentioned, eliminating caffeine, watching your alcohol intake, and doing some relaxation techniques, making sure you exercise, limiting the activity that you do before bedtime, and having a routine, a daily routine to go to bed at night. All these things will help definitely improve your sleep. And having a nice bath with some essential oils. And we're going to go into some of the essential oils later on. And trying to read instead of watching your phone late at night. And again, never taking any siestas or naps during the day, because that can also disrupt your sleep patterns during the night. And these are all attempts that you can actually make. If they don't really work, then you can actually make an appointment with your doctor, and get down to the root cause of what's really going on for you and insomnia, because again, you need that sleep, because added stress, compounded to anything that you might have, blood pressure problems, cardiovascular disease, autoimmune conditions, just will compound your conditions and make things worse for you. So environment causes of insomnia. If you're really having very difficult time sleeping at night, whether it is falling asleep or staying asleep, it could very well be that it's the environment that you are actually sleeping in. So, snoring with your spouse next to you, noise, neighbors having noise or music, the neighbor's dog is barking too loud, and there's busy street, uh, noise around the time you sleep. All these other factors, even the temperature that you have at night, can actually be too cold or too hot, and allergies from the environment can all be factors as well. So let me get a little drink. of water there. And there's a lot of other ways to actually make your room a very comfortable way for you to sleep at night, and look into feng shui ways of having a beautiful uh, relaxing type of environment when you sleep, from the atmosphere, colors, the contrast, the paints that your room has, to the mattresses that you sleep on, the different types of plants that you have in there, to the lighting, and the smell. So you can actually just incorporate a lot of different things and have the temperature just right for you to wake up during the morning and get that rest that you really need. And another environmental factor could that can actually help cause you to lack in sleep is a new baby. I know how difficult it could be to have an infant and unable to sleep, while many fathers are able to sleep through the middle of the night, feeling rested. Mothers who lack sleep, um, that's a lot to deal with. So talk with your spouse, get them on board to help you with that issue as well. So there are various ways to combat insomnia. If you have bright lights coming into your room from sources that are uncomfortable, it's important to invest in some type of blinds in your room that can actually help you sleep during the middle of the night. And noise, again, it's important to eliminate any types. You can use earbuds to eliminate that sound. And the worst case scenario, you have to separate the rooms, or move to a different room, just so you can get better sleep. So there are risk factors, and that's why I went through all the various types of factors that can actually cause insomnia, because there are very high risk factors around insomnia. Insomnia is very, very common, especially in America, um, where the stress of dealing with job, family, conflict, um, just various things, fast pace, social media, lots of things that can really cause a lot of anxiety. And it's just important to understand these risk factors. Aging or the elderly is a risk factor. Conflict in one's life is another risk factor. Being overworked, like I said, either at work or at any given day, really. And illness in a family is another risk factor. Ranking low in social status, another one, and that is probably due to comparison of watching people on social media, watching people on TV, watching magazines, watching surfing, and watching women in clothing stores, online clothing stores. So there is a lot of things that can be really irritating to our minds, that can actually cause insomnia and cause a risk factor. And having any psychological or psychiatric problems is another risk factor. So those who will be at greater risk for developing insomnia is a female and somebody over the age of 60. Now, even though many people below 60 have insomnia as well. A lot of females tend to have insomnia, and with a history of stress, anxiety, depression, any mood disorder, maybe a combination of all, and one, may have an underlying medical condition along with this, can also be an added, uh, risk factor. Negative thinking is also associated with, uh, you know, um, insomnia. We think a lot during the day, and sometimes our subconscious mind is running on, you know, just 200 times of just repetitive negativity that it can just be saying to our brain, which our mind, and this could actually be detrimental for our health. So it's something to consider, your emotional health, because things weighing heavily on our mind can actually be a very, very big problem when it comes to insomnia, because again, it affects our heart, it could affect our blood vessels, and can also lead to different things like stroke, uh, cardiovascular problems, and the list goes on and on. Weight gain. So another emotional issue is depression, and a number of other factors. Depression, almost all people who have been diagnosed with depression have a condition of having to deal with insomnia. So it's important to take care of your emotional health, first and foremost, when you are looking to improve your sleep patterns. Okay, so a lack of proper sleep can also weaken your immune system, and this is something that I've been talking about considerably for consecutively for this month. This month is an immune system supporting, and boosting and strengthening, uh, types of things that I talk about uh, this month. So sleep is another added, immune system, can support, or it can actually be detrimental. And insomnia definitely affects the immune system, and it's very susceptible to all types of illnesses, including colds, viruses, and flus. So again, as I mentioned, insomnia is very high in women rather than men. And anxiety is much more prevalent, and depression, in women. Therefore, it's another reason for insomnia, which is higher in women as well. So again, it's important to get your emotional health in check. Okay, so again, it affects all people, all generations, even children. Children's sleep disorders would include nightmares, sleepwalking, difficulty falling asleep, restless leg syndrome. Children experience these disorders at high risk when they enter adulthood. So it's very important to improve your child's emotional health as well around their sleep, because a great risk is ADHD, in which children, it eventually spills over to adulthood as well. So insomnia is really it could be really an insidious type of underlying problem that can affect you and later on cause compounded problems and chronic uh, disease. So we're going to go into a little bit about these herbs. These are really basic, simple herbs that you can pick up and use. They're not ones that homeopaths or naturopaths prescribe. We go into more deeper individualized health care or natural care for our clients and homeopathic patients, but these are simple, everyday um, herbs that can actually help benefit your insomnia in some way and get you the proper sleep that you need. So chamomile or chamomile uh, is actually a very mild, beautiful tasting type of, it's not very offensive. It's probably one of the most popular herbs out there for relaxation and inducing sleep. So lots of clinical studies out there that shows that it can actually help with chronic insomnia. So it also does helps with digestive problems. Irritable bowel or digestive problems with irritability, helps with reflux. So there's a lot of things that it can actually help with as well, and relaxing the digestive system while you are probably under some type of stress. So chamomile definitely does work when dealing with insomnia. Now we have passion flower. This is a very mild herb, just like chamomile is. And it is for when you are overtired or anxious and or really overworked. So you can actually infuse it with water with a dry herb. And if you are on the go and very busy, you can also use it as a tincture and use it about 2 to 3 times per day. And then we have kava kava. This is actually one that you want to be aware of because it does have a link to problems with the liver, but you can use it in small doses and it reduces anxiety and depression. And we have California poppy. That is, studies have demonstrated that this herb actually has the ability to reduce the amount of time it takes you to fall asleep and improves sleep quality. So definitely one to consider when you are dealing with insomnia. Valerian, very popular type of herb for sedative purposes, and it can actually may trigger some kind of mild dreams, but that might not be such a bad thing. And if you never used valerian before, it's really best to start slowly and then up the herb. So this herb also works well in combination with hops. Hops is another herb that really works very well for insomnia. And we have lavender. Lavender essential oils, like I had mentioned earlier, you can actually add it with olive oil or some kind of carrying oil to rub on your skin before night. You can also use it in a warm bath before bed. And let's go to hops. Hops is a really a beer, and it actually helps with relaxation and sleep. And you can choose this mild tea and drink it twice a day, once in the morning and definitely once in the evening before bed. So, if you are wanting to improve your sleep without any added medications that can compound or suppress your immune system, then this, going to herbals and homeopathics is really a great way if you are looking for alternatives. Now let's go into some sleep ways to improve your sleep. pattern, and I talked about feng shui earlier. We're going to go more in depth on how to improve your sleep. You can set your bed and try to stick, you could set your bedtime sleep and try to stick to it on a regular basis. So if you are an early riser, then it's important to go to bed between 9 and 10. If you get up, let's say 5 or 6 a.m. Okay, and it's important to turn off all your electronics at least 1 hour before bed. It will give you that, nighttime sleep that they talk about EMFs that can actually harm your mitochondria by producing excessive oxidative stress. So again, turn off TVs, computers, phones. You can put your phone away from you so you won't get that added blue light from your electronics. And sleep in complete darkness. Like I had mentioned before, it's important to get those blinds that can actually help. And a radio clock, if you have one, it will probably disrupt your sleep. So, it affects your hormones like melatonin and serotonin. So you want to not interfere with those bedtime, nighttime hormones. So keep that temperature around 70 degrees or so, or if you need it a little lower, just adjust it to your needs and keep that room either cooler or hotter, and can actually lead to less restlessness during sleep. And also, it's very, very important to eat at least about 3 hours before bed. Don't sleep, don't eat before bed. It affects your glucose levels. It also increases your chances of reflux and all these things, and causes, again, problems with sleep. So during the day, it's really important to exercise. I know, but exercise, it really has helped me. I exercise, at least you don't have to exercise a half an hour a day, but I do at least 15 to 20 minutes of light yoga per day, and it's really helped with my sleep and my sleep patterns. So definitely something to incorporate into your daily lifestyle. Okay, so we are now going to go into a little bit about the techniques that you can use to enhance better sleep. And mind-body techniques is definitely one. That's, mindfulness. Yoga is definitely another one. Meditation is another. Guided imagery is another. And breathing, or controlling your breath. And Tai Chi is another one as well. So don't exercise definitely 1 to 2 hours before bed. Drink something soothing like chamomile or hops right before bed. And keep your temperature, like I said, either around 70 or a little lower or a little, all depends on how you feel. And if you are going through menopause or you're pregnant, these are things that can also cause overheating. So be aware of that. And if you are congested, if you're congested during pregnancy, or you have sleep apnea is another thing, then it's important to adjust to that, get help with that. And allergies is also another thing that can make you wake up many times during the night. So again, it's important to work on your allergies. And a neti pot to rinse your nasal cavity will be very, very beneficial. So hormones is definitely something that can actually cause sleep issues during higher levels of aldosterone and anti-diuretic hormone can actually affect you because you have to get up and go to, to the bathroom. So that's definitely two hormones right there that can affect you during the night. And cortisol can spike, and these usually dips at bedtime and usually increases during the night and peaks just before waking up. Now, if it's affected in any way, then definitely you're going to have problems sleeping. So definitely something to take a look at because cortisol is released during stress. So for women, change in sex hormones definitely affects us. That's most likely why we are affected with insomnia more than men, because during our menstrual cycle, just before our period, hormones change, and then it actually, our progesterone actually drops right before menstruation. So this affects our body temperature, and which can then again affect REM sleep. And that's usually the stage when most of our dreams occur. So that's why a lot of times, we are affected during menstrual cycle. Now, perimenopause and menopause, again, that's, there's low levels of estrogen that actually contributes to sleeping issues, and change in hormone levels means that the body's temperature is less stable. So that's why a lot of times you get up, you have hot flashes, you have, sweat at the back of your neck, sweat at, between your chest, underneath your arm, underarms. You wake up because you are uncomfortable. So again, it's very, very important to check your hormones and adjust to that, and eat well, and do all the emotional techniques that I had mentioned previously. I really hope you enjoyed this video. Uh, don't forget to subscribe to my YouTube channel and hit that bell to get notified every time I have another video coming out. Thanks so very much for watching, and I will talk to you next time in the next video. Bye now.